When we look at how Parkinson's disease affects the African American and Black community, unfortunately, this community faces significant health disparities. They're more likely to be diagnosed at a delayed rate, at a later stage of disease. They're less likely to be prescribed medications, and they're less likely to be offered rehabilitative treatments and advanced treatments. Ideally, we'd like people with Parkinson's to be diagnosed at an early stage. The reason for this is if with early diagnosis you have early access to treatment. There's building scientific evidence that intense aerobic exercise combined with strength training, balance training, and agility training can actually potentially delay the progression of the disease. Fall prevention is really key. If people are diagnosed at a later stage of Parkinson's, they're more likely to fall, and this can lead to injuries and, unfortunately, other negative repercussions for one's quality of life. There are a number of barriers for people from the African American and Black community when it comes to seeking treatment for Parkinson's disease. At the level of the community or healthcare system, there are systemic barriers including insurance factors, geographic location, if someone's in a rural environment, that can prevent someone from accessing specialist or neurological care for Parkinson's disease. At the provider level, there's still the image or face of Parkinson's that's thought to be largely older Caucasian men. For that reason, often providers are unaware or fail to recognize Parkinson's disease for people that are coming from communities of color. And when it comes to the individual, there's lack of awareness of the signs or symptoms of Parkinson's disease and that they reflect a disorder rather than normal aging. A story comes to mind of an individual who expressed they actually went from doctor to doctor to doctor, trying to understand what was going on. He was told he had lupus or Lyme disease or a variety of conditions. And finally, after 10 years when he saw a neurologist, they immediately made a diagnosis of Parkinson's. But before that, no one had thought to refer him to a neurologist because there was this image that Parkinson's disease affects older white men. It's so important to know that Parkinson's does not care about one's ethnicity or race, and certainly does not care about one's gender. So women, young and old, can all be affected by Parkinson's, and all communities of color can also be impacted as well.